Very good evening to you, colleagues, and welcome to another webinar on standard operating procedures for the Ministry of Health and Medical Services. I'm Dr. Alipate. I'll be hosting tonight, and we have our very own Director of Nursing at CWM Hospital, Kelera Soata, who will be presenting our internal transfer of COVID patients. This SOP has just been confirmed today by Dr. Chemesa, so we'll be getting the official document out very shortly. We need to also acknowledge some very important people who put this very important SOP together, and I would like to acknowledge Mr. Mamatuki Sosefo, who's the head nurse at the emergency department at the Colonial War Memorial Hospital, for his work in putting this SOP together. We have modified it a little bit and will include a bit of some of the modifications that CWM has made. But again, this is a very important SOP so that everybody understands the principles surrounding the safe transfer of our healthcare workers. So just very quickly, we'll go over a couple of housekeeping rules. Kirkere, if you can all just mute your mics while the presentations are going on. We'll give an opportunity for everyone at the end of the presentation. You can then unmute and ask questions to the panel who'll be on, or you could send your questions via the chat icon. So yeah, you can send that at any point during the presentation, but we would request that you please ensure that your mics are on mute. So that's it. We're going to jump straight into the presentation, and I'd like to invite Don, Sister Kelera, to begin the presentations this evening. Thank you very much. Sister Kelera, are you there?
Can I be heard?
Loud and clear, loud and clear.
Okay, Okay, I'll begin with the presentation now. Once again, good evening to everyone. Just for the introduction, we all know that COVID-19 Delta variant is highly infectious. It's an infectious virus that's spread by droplet and, of course, the aerosol. And the transfer of patients between facilities and around various hospitals need to be done during the process. I also wish to emphasize here that transfer of patients, whether it be intra-hospital or inter-hospital, is an important aspect of patient care. Because if it's not handled properly, it could cause more harm than good. And the delays in making the decision in the modes of transfer could also affect that life that we are trying to save. Next slide, please, Dr. Alipate. The purpose of this SOP, the first one is to minimize the risk of COVID-19 transmission from patients to staff, to family, and vice versa during the process of transfer. And secondly, to ensure that standard infection prevention control practices are followed by everyone during the transfer and the discharge processes. Next slide, please. The scope of this SOP, it applies to all clinical and non-clinical staff involved in the patient transfer and discharge within the Ministry of Health and Medical Services in all our health facilities. As Dr. Alipate have just mentioned, that it has been endorsed today. Now let's look at the processes that's involved in the transfer. But before that, there are a few things that we need to consider. When working with suspected or confirmed COVID-19 patients, staff must apply standard precautions at all times, meaning that appropriate PPE must be used by both the transferring staff and the patient. Now let's look at the table on the screen. In this instant, the ambulance is used for the transfer of patient. So the first column, we have the ambulance, and the second column, we have those that are involved in the transfer. And in the third column, we have the designated role or the tasks. And the fourth one, which is the important one that we are trying to emphasize, is the type of PPE that should be used during the during the transfer. So in terms of the healthcare worker in the ambulance, in terms of the healthcare worker, whether it be a doctor, a nurse, or a nurse practitioner, the task will be transporting the suspected COVID-19 patient to the healthcare facility. The type of PPE that should be worn is the first N95 mask and the gloves, the gown, and the face shield. So the same applies to the driver, but the driver, they have two roles. First, if the driver is involved in assisting with the loading and unloading with patients, they need to be also wearing N95 with gloves, gown, and the face shield. But if they are only driving and there's distance between the driver of the ambulance and the patient at the back, then he need not wear gloves and gown, but he can just wear N95 but continue to maintain the distance. And same with the patient coming to one of the facilities, they only need to wear their surgical mask. And the driver and the cleaner, they also play a very important role because they involve in the pre and the post activities before the patient comes on and after, in terms of cleaning the ambulance and cleaning the transport or the vehicle that has been used for transportation. And the PPE that needs to be used on the site, which is the N95, heavy duty gloves, the gown needs to be worn, the face shields or goggles, and then boots or closed working shoes. Now let's move to the actual process, to the process of the transfer. So prior to transfer, we must ensure that information on the transfer of patient is documented in the patient's folder. That's number one. And secondly, ensure follow-up with receiving staff or unit on the patient information prior to transfer. This includes IP measures that must be continued. Because sometimes transfer is happening without the other parties or the receiving party having knowledge of what is going to, of the type of the patient that is really coming across. So sometimes they're receiving patients that they do not expect, and the preparation is not really they are not really fully prepared. So that is why it's important that we have proper follow-ups with the receiving unit or the receiving ward in terms of the patient that is going to come prior to the actual transfer. Next slide, please. And this is a very important part of the process, which is during the transfer. And I must emphasize here that during the transfer, communication is very important. Before the transfer, during the transfer, and even after the transfer. So during the transfer, we must ensure that the patient wears a surgical mask throughout the transfer to minimize the dispersal of respiratory droplets when this can be tolerated, and providing this does not compromise clinical care. Secondly, the staff in charge of the transfer will ensure that designated route for transfer is followed, including the designated elevator. And we are specifically referring to CWM in most of the things that we have mentioned here, but generally we could also apply what we have here in terms of the respective facilities. If the transfer happens on one floor, or if the lift is being, or the escalator is being used. So to ensure that the receiving unit is ready to receive the patient, and there is an agreement with the ward or the department to commence the transfer. As I have mentioned before, they should be expecting the patient at this designated time, ensuring that the receiving ward or department are aware of the expected arrival time. And fourthly, ensure the route is clear. This may include designated lifts and stairways. If we have a common route and many entries like us at CWM Hospital, this is a very important, it is very important that this is communicated, because before any transfer happens, everyone needs to know that there is no one needs to be on the way during the process or the transfer process, yes. And on arrival at the designated handover point of the clinical area, we must make sure that hand hygiene is performed prior to handover and the maintenance of physical distance wherever possible. For patients receiving respiratory support, non-intubated patients should be transferred wearing a surgical mask over their oxygen delivery device. Staff should wear PPEs, that is gloves, gown, eye protection, and N95. An N95 mask is required if patients are receiving high flow oxygen or intubated. Where possible, corridors must be cleared and only essential staff should accompany the patient. Intubated patients should be transferred using a closed circuit fitted with a viral filter. During the transfer, a plastic covering for transport equipment may be used, example, over the transport ventilator. And proper cleaning of transport equipment is required after the transfer, example, wipe with 70% alcohol or sodium hypochlorite. And the next slide is, you can see from the diagram down below is roughly what we are currently following here at CWM. And for those who are working in CWM, and for those who have also worked in CWM, would have noticed that transferring of patients is not an easy task, because we have very long and sort of complicated corridors. But this is what we have been following. So the diagram summarizes what we have here. So I'll just read it out. It's the first one, the ward supervisor or the nurse unit manager to inform receiving supervisor and depart only when they have confirmed that they are ready to receive. That's very important. We need to effect, the transfer needs to happen when both parties are ready. And any corridors can be used for transfers. The route taken should generally be the most direct. And yeah, it's ambulance are not required, although we may also use ambulance in some of our transfers. Ward staff should inform key security staff along the route of their departure. The security officers are very important because they are the ones that sort of code off the areas, and they stop all movement of personnel, whether it be our own staff in the hospital or other patients or relatives moving around. It should be stopped. That's the important role of the securities. And the lead person must be in front of the trolley to ensure that corridors are clear, asking all other persons to move at least 1.5 meters away from the transfer party. The lead person can carry a noise emitting device if available, maybe a whistle or a bell, or if you have a loud voice, you can just shout and say, clear the pathway, and while this is happening. And that is, and the number 5, the cleaning and the disinfection. All high touch areas, which is buttons, door handles, and any accidental touches of corridor and walls should be wiped with cleaning agents. and disinfectants or antibacterial alcohol wipe as per IPC protocol. And secondly, the spotter will direct the hygiene staff on areas to clean and disinfect or conduct the cleaning thoroughly themselves. When we say the spotter is the person that's behind the transferring party. And the leading person at the back could be, we've used some of our registrars, we've used our nurse unit managers to clear the way. That's after the securities have done the clearing up. And the middle part is the patient with accompanying doctor or nurse. And the one at the back is the spotter, who will be taking note of wherever there's any accidental touches or anything, and who will be notifying our hygienist on which areas that needs to be disinfected after the process. Well, I think that's the end of the presentation this evening. And I'll open the floor for any discussions or any questions, and Dr. Alipate is on the other side to assist in terms of any clarifications. But this is what is happening at CWM. The last slide is what we are currently practicing, but the SOP is what that has been endorsed this morning, as Dr. Alipate has alluded to earlier. Thank you.
Don. So once again, that was Matron Kelera Soata, who's the Director of Nursing of the Colonial War Memorial Hospital. And yes, colleagues, so this brings us to the end. It's a very short, very succinct SOP, just about the transfer of patients, either, as Don mentioned, from facility to facility, or within a facility itself. And one of the key things here is communication between the transferring team and the receiving team. That's very important. And communication, right throughout as you're transferring the patient, making sure that everybody's wearing the appropriate PPEs, everybody's aware of it. And that's the spotters for the communication, the transfer within the wards or within the hospital facilities. The job of the spotter is extremely important, so that he can pick up any IPC rule breaks and go ahead with disinfecting at that point in time. Sister Ely, you've joined us. Do you want to share anything else? Does anybody have any questions that you want to put in the chat platform, or just raise your hand and go ahead and unmute yourself and ask a question this evening?
Thank you, Dr. Pate, and thank you, Madam Dawn, for the beautiful presentation. I think it's very simple, and I guess everyone that's listening in this evening will be able to understand and even tailor-make this presentation to their very own setting in terms of transfer. I think the basic aspect of the scope and the processes of IPC is actually well embedded in this presentation. And I guess if we actually take that on board and actually put it in our very own setting, it'll become very easy. And the main key points that it has been alluded this evening is the key IPC measures in terms of the transfer. I think that's basically what's very important that we need to take on board. And the timing of actually getting the transfer done, whether it's coming from FEMAT to CWM hospital or from CWM hospital to other isolation facilities, all these issues need to be taken on board. That timing, it needs to be fast, it needs to be well communicated, and everybody else on board on the other side needs to have a clear communications of who's bringing the case, the discussions of the case. It all needs to be happen in times coherent to the transfer, and also taking into account the availability of the mode of transfer, whether the patient is going on ambulance or other mode of transport. I think Madam has actually covered that very well, and that's it. I think the information on the transfer of patient, the documents, all this need to be prepared well and needs to be put in a plastic cover and well follow up. If people not unsure, you can always call your IPC link to find out how can you get this across, because all this little information is very important prior to transfer. And the staff, how they communicate, especially when it's a transfer of critical patient. Like say, for example, if you're pushing an acute case to the ICU, or how you're pushing case from stable isolations to a very sick ICU isolation. Timing needs to be taken on board, and all the critical aspects of delivery needs to be enrooted with the patient, with clear designations who does what, because sometimes in the middle of the transfer we get confused. Okay, you push the case, and then when we look for the orderly or for the second person, like what Madam was talking about, that person is not there. All that needs to be well communicated, and the lead person, the one that is leading, should be the ones taking control of the transfer, so that your transfer will reach your destination, and also everything that is expected from the other side, you are taking with the patient and routing to the route of transfer. I think that's probably my contribution, Dr. Pate, Vinaka. And thank you, Madam, for the presentation. Vinaka.
Vinaka, Sister Ili. So Sister Ili is the head of IPC for CWM. Just another thing. So during our presentations, you'll notice that our SOPs actually touch on multiple other SOPs, and Don actually put this in. If you have a look at this table is extracted from the SOP for the rational use of PPEs. So that's involved in transfer. The other important SOP that's involved in transfer is the environmental cleaning and decontamination. That's another SOP that's linked to this one. And CWM has just made another one regarding the management of patients' folders. So what happened in the past was when a patient moves from one facility to another, or from one ward to another, the folder is not moved with the patient. So the new SOP that we have created is one that says that folder treats the folder as contaminated and moves with the patient. So that at each point in time, you're able to have the information from previous treatments, and it just continues rather than breaking that cycle of information. Key. And so the folder just moves with the patient until right up to discharge, and then is kept aside for a period of time, which then just it kills the virus automatically over a period of time. I forget what it is, 4 hours or 48 hours, something like that. But anyway, so the folder goes with the patient. What I'm trying to explain is that there are multiple SOPs that are also in play with this particular one with transfer. Anyway, colleagues, it is a very simple SOP to understand, and we'll open it up one more time for questions. Does anybody have any particular question based on this SOP or any of the SOPs that we have discussed so far? You can unmute yourselves and ask the question now. Thank you. Somebody shared something from Lautoka, Christine. Oh, they have an announcement over the intercom before the transfer happens. Yeah, that's awesome if your intercom is working. I think at CW, intercom isn't working very well. So, but that's good. That's something. Yeah. Okay, awesome. So I take it that everybody has understood that. Thank you for sending your emails. We will send you the SOP once it's been finalized already. So we'll send you the SOP, and at the same time, sorry, the presentation for tomorrow on the safe COVID-19 body, that presentation is going to be postponed because they need to look into a few more things. We had the task force meeting this evening, which finished just an hour or so ago. and we need to relook at that SOP again in a bit more detail. So we won't be having any webinars tomorrow. Stay tuned. We will definitely have some for next week, and we'll send out the link very soon. But otherwise, thank you, colleagues, for joining us this evening. Thank you, Don and Sister Ely, for your contributions. And you guys have a good evening, and take care. Fiji go, Fiji everyone. Don't go crazy celebrating with your friends. Remember, we still have to social distance and all of that. But thank you very much. Have a good evening, and we'll see you again next week. Vinaka.
Naka. Thank you.